Side effect, any side effects from anyone? I had a little headache and that was it.
I was sick the next day with a fever and chills, but just for one day and then fine with both vaccines, the first and
Yeah,
the second.
I had a couple people call me here in Snowmass Village describing those symptoms as well. So,
Yeah.
and they called their
I'm
doctors.
I'm sorry, but you're all too young for this. How did you get ahead in the line?
Oh, you're too kind, Postman.
Yeah,
I
exactly.
had a couple of days of fatigue after the or malaise after the first shot, but I don't know what, I may have been just lazy, so blaming it on the shot, but that was about it. It was pretty minimal.
I'm looking around to see if we have quorum. Jordana does say that we have quorum. And therefore, we're going to go ahead and call the meeting to order. And this is a very important meeting because we're going to be talking about the new dial, the state dial, and what the staff recommendation will be today. And we'll have a good discussion on that. So without further ado, the meeting has been called to order. And I will ask you to review the agenda and see if there is any addition to the agenda. If not, do I have a motion for approval for the agenda?
Motion.
Thank you,
Second.
Linda. Thank you,
second.
Greg. All in support, raise your right hand. Okay. Moving on to the minutes, we have corrected minutes of the last meeting, which was January 28th. I'm sorry I was unable to join you. Thank you, Greg, for chairing. I was discharged by the Stedman Clinic. Hopefully this is my last shoulder surgery and we're all good to go. So I'll see if there's any corrections to those minutes. If not, do I have a motion for approval?
Yep.
Yeah, Linda, thank you. Brent, thank you. All in support. I will not be voting since I was not here. Billy, you were here. Can you raise your hand if the minutes were fine? Thank you very much, Bill. Let's move on. Data update. I just opened the report for today. All good news. Who's going to be presenting? Josh?
Yep, it's me, Marky.
Good to hear your voice again, Josh. How's life treating you?
Going all right, Marky. How are you doing?
I'm awesome.
Good.
So go for it. Okay, Josh, we lost you.
I'm just waiting for the,
Okay, there you go.
I'm just waiting for the PowerPoint to open
Okay.
up.
Lindsay or Raleigh, are you able to click on that first data update slide and put it in presentation mode?
Hey, Abriel, are you there?
Are you seeing a Gartner Magic Quadrant? Is that what's up now?
No, I just have a slide that says special Board of Health meeting February the 11th.
Well, I don't.
All right, everyone, just give us a couple seconds here. Let's see if I can help them troubleshoot.
Okay.
Thanks, Abril and Suzuho.
Great. So first slide here is showing you where our current incidence rate is sitting and also shows you where we've been in the past 21 days. The colors of the bars indicate which level on the new dial we would fall into, which Jordana will be presenting later on in this meeting. But just wanted to show you the elasticity of the new 7-day incidence rate and how our instance is able to move around a little bit within these new parameters. But more importantly, wanted to show where we have come from over the past 3 weeks. So you'll see that our 7-day incidence rate back on January 21st was at 681, and that was down from a high of a 7-day incidence rate close to 2,000. So we really dropped off pretty quickly and have now leveled out. Starting around beginning of February, we've been seeing a leveling out between 200 and 300 or so, our incidence rate. We've been averaging significantly fewer cases per day, around 4 cases or so per day at this point. Again, which is down from about 40 cases per day back in early January. Next slide. So then I wanted to show this data. So we had some more data that's been made a little bit more accessible and available to us from the state, looking at mobility and correlating that with our incidence rate. So the gold line on here is our 7-day case average. So total number of cases that we've had over a 7-day period. And it is correlated with the visitors per resident ratio. So these are the number of visitors for every 1 resident we have in the county. And it's combined into a ratio. So for example, at the peak there, the teal peak, if you go over to the right, you'll see that our visitor per resident ratio is right around 0.77. So there was 0.77 visitors here for every 1 resident. And so what we see here is that as the number of visitors to Pitkin County increases, about 7 days later, we see an increase in our incidence rate. And that was a pretty consistent correlation that we've seen throughout the past 2 months. The R value here is 0.62, which indicates that we have a pretty significant or moderate correlation. So it doesn't explain all of the cases by any means, but it does show that when you have an increased mobility and you have more crowding in an area, we know that SARS-CoV-2 virus does tend to transmit more easily in those types of settings. So this graph here is really just, again, indicating that correlation. Over on the right-hand side, you'll see that while we had sort of a plateauing of that visitor per resident ratio, it has begun to increase slightly in the past few days and is now beginning to move back up to where it was mid-January. And so that's something that we're of course watching as, again, we know by looking at this chart that we tend to see our incidence rate begin to increase after we see an increase in mobility or visitors. Next slide. And then this one's pretty similar, but just showing you something a little bit different. So this again is your 7-day case average in the gold or the yellow. And then it's devices per day. So these are the number of devices that are pinging in towers. So not all devices here are registered or are interpreted by the state's system that they're using to collect this data. But it does show you a good enough proportion to be able to make some assumptions here. So again, the devices per day would include anyone. So not just our visitors, but it would include people that live in the county as well. And so really it's looking at just kind of overall population, for lack of a better term, just understanding how many people are within county limits. So again, here we see sort of the same idea that when we see the number of devices per day in Pitkin County increase, about a week later, we see our incidence rate increase. So this one is pretty similar to the last slide, but I wanted to combine everyone into one and not just look at tourists alone, but to look at every single individual that would be counted in this graph. Next slide. So then moving on to variants and looking at where we're at with these new variants of concern. So the main variant that we're been focusing on is the B117. That was the variant that was first discovered in the UK. In Colorado, we've now had 37 specimens come back positive for the B117 variant. And there's been 932 reported across the US. The proportion of these new cases of the variant are increasing about every 10 days, or doubling about every 10 days. So this is what we saw at the very beginning of the pandemic when case counts were increasing or doubling about every 10 days. We're seeing the same sort of trend here with the B117, is that it's doubling every 10 days. And the expectation is that it will begin to double every 7 days, then every 5 days, and so on until potentially it becomes the predominant variant circulating in the US and potentially around the world. And then over on the right-hand side, you'll see the P1 variant out of Brazil. We've only identified 3 cases in the US, and they were all travel related so far. So individuals that had traveled out of the country, but then tested positive for the P1 variant. And then on the bottom right is the South African variant, which has been in the news more recently because there was some concern over one of the vaccines not being as effective against the B135 variant discovered in South Africa. So that's a current update on nationally where things stand in terms of the variants. Next slide. So here are some of the concerns regarding these novel variants and why they're important to discuss. So one study found that the relative hazard of death in these new variant infected individuals, so people that were infected with these new variants compared with those who were infected with original variants, was 1.35 times higher. So what this shows is that there could be a potentially 30% increase in mortality related or associated with these new variants. And not all the new variants are going to fall into that category, but some of the new variants are showing that they likely do have a slightly higher mortality rate, up to about 30% higher, which of course is something that everyone's paying close attention to try to understand, is it just more transmissible, or are we seeing an increase in mortality? And this one study found that there was an increase in mortality. Secondly, they have found that a national lockdown in the UK did not have a great effect at actually reducing the total case counts. With these new variants. So whereas the lockdown seemed to have worked pretty well against original variants, against these newer variants, specifically the B117, the lockdown was not sufficient to reduce that reproductive number. So it was essentially plateauing the cases rather than causing them to decrease because of its increased transmissibility. And then there's also, as vaccines are rolling out, we know that for the next several weeks to months, because there's still a relatively low number of individuals who are being vaccinated, that transmissibility of these variants is still very likely, especially as communities are still building immunity to these to SARS-CoV-2 and to these variants. So there's concern that just because people are being vaccinated, we're still a ways out, right, to get to a point where it's going to actually have a significant impact on the total number of individuals being infected. So just for the next several weeks and months, we're still in the same kind of boat. We're still monitoring, being vigilant, and surveying all the information that we're getting, because we know that we can still see spikes and increases moving forward. And then lastly, the B117 has mutated even more. And so in Bristol, England, they discovered a new variant, which is a branch off of the B117. They're calling it the E484K. And it's mutated further, and UK officials are worried now that the B117 could actually threaten vaccine efficacy. But I do want to mention that there's a lot of discussion out there about vaccine efficacy being reduced with these new variants. It's still important to know that even with the flu vaccine, for example, even if it's only 45% effective in any given year, it still provides significant protection and can likely avert severe outcomes. So even as there is more discussion around, reduced efficacy around the vaccine with these new variants, a vaccine is always, still going to provide considerable protection, and it's still extremely important to be vaccinated when the time comes around to be. Next slide. And then another thing I wanted to mention with these new variants is an article that came out of the CDC looking at double masking, and they're finding that when you actually have a mask that is more tight fitting to your face, you're going to have a reduced likelihood of exposure to SARS-CoV-2. And so this study looked at what was the percentage of particles that were being blocked when wearing a surgical mask alone. They found that about 42% of particles were blocked just by wearing a surgical mask. And then a cloth mask was pretty much the same, about 44%. However, they found that when you wear a surgical mask underneath and then a cloth mask over, it closes a lot of the gaps that are caused by a surgical or cloth mask that you can't, that you really can't enclose very well on your face. And so that cloth mask pushes the surgical mask more tightly against your face, and actually was able to block 93% of particles in the simulation that these researchers did. And then when both individuals are doing the same thing, so when both individuals are wearing a surgical mask and a cloth mask, the percentage of particles that get blocked are 96%. So they're finding that, this double masking may actually be pretty effective, especially against these new variants. Being more transmissible and being transmitted in an aerosolized form, having a more tight-fitting mask may actually provide a significant amount of protection, not just against the new variants, but against the originally circulating variants as well. And then other effective options were wearing a mask fitter to also push the mask more tightly against your face, or wearing a surgical mask underneath and then wearing that nylon gaiter type covering over your mask also provided significant protection. So this is something that's been discussed a lot more recently. CDC just put out this information on this and thought it was important to share, especially as this starts to make the news more and you start hearing more about double masking. Next slide. And then real quick on variants in Pitkin County. So we did have 2 residents that were identified with a marker that was potentially indicative of a new variant. Unfortunately, these patients had low viral load. And so the state lab was not able to perform sequencing. So we won't know if these individuals were actually positive for the UK variant, but there was not enough virus in the specimen for them to sequence it. So these 2 cases will remain suspected variant cases, but we will not be able to confirm them. So at this time, we have no additional suspected cases. Those are the 2 original ones that were reported last week. We also did extensive testing for the individuals that were suspected of having the variant. We tested over 200 individuals and had those specimens all sent to the state lab. There was 11 individuals that we had some concern about, either because they were symptomatic or they had tested positive for COVID-19 during the incubation period. But 0 of those 11 that we had concern about had a marker that was indicative of a new variant. So we feel that with these 2 individuals, whether they had the B117 variant or not, we feel that we have been able to at least contain this outbreak here. We'll move on to the next one, but we did a lot of work on this one to really try to contain it, and whether or not it was the B117 or not, we feel like we're able to close this one out for now. Next slide. So then lastly, just looking into the future, did want to share this slide. So on the left-hand side, we're looking at total activity. So again, this is really, again, looking at cell phone data and identifying how much activity is occurring within the county. The pink line, that is last year. So you can see the total activity that we saw last year. The big spike there is at the end of December. As you move over to the right, you'll see that we had another spike last year, January 2020, right at the end of July, and then another spike around Valentine's Day and President's Day. So that's what the pink is showing. The red is showing you this year. So this is total activity that we're observing this year. And again, you'll see that it trends really well with the total activity from last year, but it's less, right? So it's close to half of what it was last year at certain points, especially in December. But more interestingly, you'll note that over in the middle of January, so where that middle pink spike is, we likely averted a bump there due to the red level restrictions that we had in place. So we would have expected that the red would have increased in that little bump in the middle there, but we did not see an increase, which means that total activity was down, likely due to the restrictions that were put into place. But looking over to the right-hand side, we know last year that we did see a spike around Valentine's Day and President's Day, and I mean a spike in activity, not a spike in cases. And so if our red levels continue to trend with what we saw last year, so if that red line trends back up, then we know that we'll see an increase in activity. And then looking at the blue line is our incidence rate. And so you'll notice again that when activity increases, incidence rate increases. So the concern here is that as that red line potentially increases as we move into Valentine's Day and President's Day weekend, that we could see an increase in our incidence rate following that increase in activity. So, as we try to understand what we might be seeing in the next week or so here, I think, we have to look historically to see what trends look like. You'll notice right at the very end of the dark red line, we're beginning to see a slight increase where we had been seeing a plateauing. So if that number continues to go up, then we could likely expect somewhat of an increase in our incidence rate. It'll just depend on how high that line goes up, to try to interpret what our incidence rate will look like. So I think that's all I have. I'm going to pass it off to, I'm not sure if Dave
Hey,
Ressler
Josh.
or Kim Levin.
I do know we have some questions.
Oh, okay, sure.
Greg?
Only that I wanted to make sure I understand the definition of activity again. I just want to make sure I'm clear on that. Could you, I was looking at the scale, 2,000, 4,000. Can you tell me again what that means?
Yeah, so it's looking at cell phone pings to the towers, and so they're counting this total number of pings that are
Got it.
being
Thank
towers.
you.
Yep.
Thanks.
Okay, I think we're ready to turn it over to Dave.
Good afternoon, everybody. Dr. Levin wasn't able to participate. She had a family emergency, so it's your lucky day. You get me. I'll try to cover the hospital's status. I don't think I can be as effective as Dr. Levin is in giving you the big picture, but I have come prepared today after having had several conversations with our providers, our physicians and others, to try to give you that perspective, as Dr. Levin always does so effectively. So with regard to the hospital's status, we, at this time, as indicated, this is a screenshot from the website, are still in the green zone. With regard to our inpatient hospitalizations, we actually don't have anybody in-house today with COVID or that's under investigation for COVID. We do continue to see patients in our emergency department in the middle category there, and our respiratory evaluation center. But the numbers are down. We definitely have seen a decrease. And the message I'd like to bring to you today with regard to the amount of demand at the hospital and activity at the hospital is that it is decreased, and it is decreased across the region. Valley View Hospital, St. Mary's Hospital, but in particular here in our community, I just have to tell you how relieved we are as your hospital, your medical staff, that the incidence rate has decreased so much in the community. It is just such a weight off of our shoulders, that sense of concern that at any time while those incidence rates were so high that we could have been overwhelmed was very stressful. And now certainly there's still incidents in the community. I don't want to make light of what is still here, but it is significantly decreased, as you all know. As a matter of fact, it's great news for the community. So the term comfortable that we chose way back in March for the green category is just a term we came up with. It did not mean that when the incidence rates were that high that we were anywhere near comfortable in terms of our concerns about the potential for the impacts on the healthcare system by the amount of virus that had been in the community. The last category, essential healthcare workers, this is another success story and is really good news. As of today, we have one person out ill with COVID-like symptoms. We have other people out for different reasons, but we have one person out with COVID-like symptoms and one person in quarantine. So a total of 2 people. We are essentially at a full complement of our workforce. And we attribute that to 3 factors, three different contributing factors. The first one is the reduced incidence rate in the community. So certainly our employees have been subjected to the same community spread as everybody else. And that was causing a real strain. You may recall that just a couple of weeks ago, we were in the red in this category. We were very concerned about the number of people we had out ill. The second contributing factor is that we're all following the rules here. We continue to wear masks. We continue to limit access to the hospital. We continue to not have in-person meetings. The third is our vaccinations. There is clearly a vaccination effect. Now that most of our employees have all had their second shot, and we're, as a matter of fact, 2 weeks past that point. So this is what we're calling the vaccination effect as being a significant contributing factor. And we're very pleased with that. And I think that should be a message to you and the rest of our community about what lies ahead as we continue the vaccination efforts. And on that note, I want to add that we're all talking about vaccine hesitancy and what rate of the population will choose to become vaccinated and how important that is to our overall ability to be able to return to normal activities. And I can tell you that at the hospital, I'm very proud to say that so far over 77% of all of our employees have been vaccinated, over 77%. And there are still over 30 that are waiting to get vaccinated that weren't able to before because they were either out ill or they were in quarantine. So that percentage is climbing. And what does that mean? Again, we can see the effect that's had on a number of people that are out ill, but that also should be a very loud and clear signal to our community, to anybody that is wondering whether or not they want to get the vaccine when it's their opportunity to do so. If your trusted healthcare professionals that know a lot about these vaccines have chosen to receive it, then I think you should feel comfortable doing so as well. And the benefits that we have seen in terms of reducing the spread in our hospital and the number of people that are out ill will likewise accrue to the rest of the community. So that's one of the key messages that I wanted to let you know about. But I also want to just say one more thing, circling back to my comment a minute ago about us still following the rules. Whenever we have meetings here, between individuals, or if we're in a department or anywhere in the hospital for that matter, we wear our masks and we keep distanced. Even though theoretically, most of us are vaccinated, we don't change our behavior. We have not changed our behavior. And that has continued to contribute to us not having the virus here in the facility. And I just want the community to consider that in your own lives. And after you've been vaccinated, don't assume that it's time to start backing off the 5 commitments. Please, that really is very important. And the last thing I want to say is that I know you're going to be talking today about what the reduced incidence rate means for our community, and the hospital is very excited for our community to be able to resume some economic activity over time. And we're very pleased to see that incidence rate come down. We know how important that activity is to our social determinants of health, which is very important to all of us and something you've taken very seriously. But we can't start becoming so relaxed, and certainly in our own behaviors out in the community, in terms of how we abide by the 5 commitments of social gatherings, or even just if we go out to eat, making sure that we follow all the rules, avoid congested places, etc. You still don't want to get this virus. And so even though the incidence rate is down, what it still means to individuals is what our medical staff would like to convey. And that is, this is not a cold. This is not a flu. This should not be taken lightly. We are seeing a significant number of people in our community that had the virus and are still experiencing symptoms. Josh has reported on this with regard to some of the data that public health has been keeping with people that they're tracking. And we can just tell you observationally at the hospital, it's still pretty scary. 30-year-olds, weeks and months that were perfectly healthy after having had the virus still can't resume normal activity, still have the fog, still have extreme fatigue, and aren't able to partake in the activities that they've long enjoyed. So I just want to give a shout out to the community to please continue to take this virus seriously, no matter how low our incidence rate gets, and how much activity we're able to resume. Protect yourselves, protect your family, and protect the people you care about. So I will stop there. It felt like a lecture. I apologize for that, but I'm conveying a message from our physicians and medical staff at Aston Valley Hospital.
Thank you, Dave. That was, quite frankly, that was very enlightening, and thank you for bringing us those messages because they're so very important. I'll see if there's some questions for Dave, but it's all very positive news. Okay, Brent, please go forward.
Yeah, it's more of a technical one, Dave, but I'm just curious, does the hospital here have access, and I mean, I throw these names around like I know what I'm talking about, but remdesivir, Regeneron, ivermectin, convalescent therapy, et cetera, or do people that get to a level where they might require that, are they sent somewhere else?
You actually had a little bit of a laundry list of different capabilities that we do have, Brent. So I'll try to just break it down. Remdesivir, we do have and administer to patients that are acutely ill. We haven't had any for a while. It is in limited supply, but we have an allocation of that. But some of the items you mentioned are actually monoclonal antibodies that that are starting to be distributed in greater frequency. But I need to point out they are still under investigation, and there is still a fair amount of discrepancy. And some of the physicians on the call today, Dr. Siebold might be, or Dr. Giesel might be in a better position to speak about this. I will say that it is available in the community. We have a partnership with Valley View Hospital, and this is for individuals that are high risk, but that don't yet need to be hospitalized. The idea is to give that therapy before they do. And so that is available through Valley View. Not every hospital in the state is providing it. But again, I just want to say our medical staff is tracking the evidence very closely, and it's evolving as to which of those are effective. So I'm going to stop there and see if Dr. Siebold or Dr. Giesel would care to speak to it from a physician point of view.
I can comment on the monoclonal antibodies. They need to be given in the first 72 hours to be effective.
Yeah, I can just comment too that my husband has ordered this and gotten this for some of his patients through the relationship with Valley View. So it is available to our patients who require it.
Thank you.
And I can't remember, seems like there were some other medications that you were asking
Yeah,
about.
Brent, you had other meds in there. You need to unmute.
Hard to believe. Anyway, yeah, I saw a presentation, you probably saw it too, from this rather compelling guy, chief of staff at United Memorial, talking about ivermectin and, you know, tasking these, like that one's an anti-malarial, but tasking these kind of off-label, whatever you would call it, drugs. And he was, apparently there's a number of places in Texas where they're using this kind of thing, and much like Tom said, the key thing is right in the beginning, apparently. And I wonder just whether our hospital, or at least Valley View, would be able to, have those kind of things available, and apparently they do.
And that's what I would say too, is a lot of times, even before they get to the hospital, we are seeing this in primary care clinics. And the lucky thing for this entire valley is that we have been very lucky with not having too many extremely sick people. So we haven't had to use this with very high amounts.
Good to know. Thank you.
Jeannie, did you have any additional comments?
No, I just know that Regeneron has the monoclonal antibody cocktail, which is sort of a mini vaccine for exposed people, but I don't know if the hospital's using that at all.
Okay.
That one, Dr. Siebold, I don't believe we have had access to yet, us nor Valley View, but we have had, as I've mentioned, other monoclonal antibodies. I don't even want to try to pronounce it, but there's a different one by Eli Lilly that has been available in the community. Dr. Giesel, that's what you were referencing, has been prescribed for some of your husband's patients.
Okay. Any other questions for Dave? If not, let's move on the agenda, and Jordana, I think this is you.
Thanks, Marky. So today we'll walk into an understanding of the Dial 2.0, what are the changes, and then some recommendations for how we can adapt and what we can adopt here locally. So overarchingly, when the state went back and updated the dial, they increased the incidence range metrics for all of the different colors. So most counties in Dial 1.0 had been in orange and red for weeks, some newly into yellow. Across the state, we've seen more counties move down into yellow and blue because of the changes to those dial level metrics. The additional stipulation that was put on this dial is because of the new ranges, counties that are in yellow who do have a 5-star business program are only able to operate that program into blue once 70% of 70-year-olds across the state are vaccinated with at least 1 dose. So that's expected to happen at the end of the month. So we'll keep that in mind when we talk about 5-star later on in the presentation. Next slide, please. Additionally, I think the board is well aware that the Dial 2.0 moves to the 7-day instead of 14-day incidence rate metric. Level of testing, positivity, and hospitalizations as well are looked at on that 7-day metric for that more swift ability to move between colors. And so this is what we've been talking about sometimes when we're saying that this new dial is going to be more elastic. There's going to be more quicker movement, both into more restrictive levels and into less restrictive levels. There have been some tighter metrics on the level of community testing, so that % positivity in yellow and orange were adapted. The state has also come out to say that there'll be consideration of additional metrics for counties under 30,000, but they haven't told us exactly what those are. So we're still waiting on that to come out. In this new dial, the mitigation plans are not going to be required before moving a county into a more restrictive level. If you'll remember back in Dial 1.0, when you hit the metrics for the next level, you had some time to come up with mitigation measures and then put those into effect locally and then give them a couple weeks to see if they were going to have any effect. And then if not, then they moved you to the next level. And so really what the state has learned that in all of these counties, many of the mitigation plans that were put into place didn't really ever have the effect of preventing that move into the next dial level. So this effort is to really address that learning. And now with this 2.0 dial, the movement from one level to the next is going to be more swift because they see that that's really what has had the best effect on the incidence rate and accompanying metrics. Just a couple capacity level caps that we'll go through when we look at the specific capacity levels. And this dial became effective at the state level last Saturday morning at 9 a.m. So if you move to the next slide, we'll see the metrics. So, I think a lot of folks were getting very familiar with the levels, with our 14-day incidence rates and how those corresponded to the different colored levels. And now you'll see that starting over on this right side with the red level risk, the new dial is for you hit level red at 500 per 100,000. Level orange is between 300 and 500. Level yellow is between 100 and 300. Blue is 15 to 100. And protect our neighbors level has metrics all its own, which we are also tracking independently. I'll just leave this here. You can just see that there's also the percent testing positivity that has updated metrics for the different dial levels, and as well as the hospitalizations. Next slide, please. So why did the state update this dial now? So they really state that across the state, they were seeing a decrease in incidence, hospitalizations, and percent positivity, and also wanted to acknowledge the administration of vaccinations to the majority of the individuals in the 1A and 1B1 phases, recognizing that especially in that 1A phase, our hospital workers who were at highest risk for coming into contact with COVID positive patients are now being able to have the protection of the vaccination. The next slide demonstrates the movement between levels. So to move to a less restrictive level, a county needs to meet all of the metrics of the less restrictive level for a 1-week period, according to the state's data. And then the county can move levels once all those metrics are confirmed between the county and the state. If you look to the next slide, this outlines how in this dial we move to a more restrictive level. And so the state's really recognizing here that disease incidence is the leading indicator for moving to a more restrictive level on the dial. You know, this is what we've seen is that our incidence rates tend to move first, and then the percent positivity and hospitalizations are more lagging indicators. So this dial recognizes that a county can be moved on disease incidence level alone, and that once that metric for the new level is reached, the county is going to be notified and then move swiftly into that level. They are also reserving the right that a lack of sufficient testing or a strain on the regional or state hospital system can also result in the county movement, even if disease incidence rate hasn't hit. So you can move into a more restrictive level for hitting any one of those indicators, but they recognize that incidence is probably going to be that leading indicator. And that's the same for movement between any level. You know, in the prior dial, movement into red was in practice, you know, they were asking for 2 indicators to be met, and that is no longer the case in dial 2.0. So just some things for the board to consider as we're thinking through the adoption of this new dial. So firstly, really understanding that the incidence rate is identified as the leading indicator. And I think this is something that we recognize and that has been true in our community locally as well. Thinking through that, you know, when the pandemic started and we really started talking about this, hospital capacity was the main thing that we were really putting out there as needing to protect and developing our measures and strategies accordingly. And, you know, Dave spoke to this very eloquently earlier. But as we're moving forward in the pandemic, we're realizing, you know, why that controlling for that incidence rate as a leading indicator is really important to consider. the lower that we're able to keep our incidence rate, the lower spread of the new variants we're going to see, which we know are more transmissible. And so when they do catch on, we're going to see an even steeper rate of transmission. Keeping that incidence rate low also, allows for less variants to potentially mutate and be created. So it's another idea, another reason that watching that incidence rate and trying to control for it is important. And then finally, those long haul effects that Dave really spoke about, that we know are impacting, according to our data, 50% of the folks that we talk to and follow up with 6 months later are having those still very significant long haul effects from COVID. 7, just also thinking about, we've talked about this a bit, the elasticity and the 7-day rate versus 14-day incidence rate. More elastic, where it's going to be quicker for us to move in both directions on this dial. So that's going to be something that's new for the board and for the community to understand. This directly relates to that we're going to have the potential for the dial levels to change more frequently than they did in that first dial model. I think we've talked through many of these points, but just the things that we're still not quite sure how they're going to impact this new dial, because they're constantly changing, is the emergence of the variants and when they become if and when they become the predominant strain in our county, in our community, how that might impact spread, and if the model counts for that. The state has said that this is taking into consideration the vaccinations that have occurred in 1A and 1B1. And we know that the number and percentage of folks in our community is going to be constantly changing as we vaccinate more folks. So these are just kind of moving pieces in the modeling. Also, Dave spoke very eloquently to this about the need to continue using these transmission control measures. So distancing, masking, limiting exposure, even as more of our community becomes vaccinated, and even if incidence rates are lower, they continue to be incredibly important. And as we move to dial levels that maybe aren't as restrictive, knowing that those personal behaviors, individual behaviors outside of the capacity restrictions also play a huge role in the kind of transmission that we see in the community. The last point is that counties with ski resorts are seeing higher incidence rates than other Colorado counties. So the state has been doing some modeling around this, and we'll go to the next slide to really start to understand this, so that we know that when the dial was developed, it was really to account for what's the situation in Colorado overall. But what we know is through some of this data analysis that the state has done, these 7 counties they pulled out that all had major ski resorts are at the top there, and you can see the incidence rate that hasn't been declining as rapidly as it has in other counties across Colorado. And if we go to the next slide, I think that Josh and the mobility data that he shared early on helps explain some of the differences in epi curves, as well as this mobility slide. So this slide's looking at Gunnison, San Miguel, Route, and Pitkin, and looking at the mobility data between locals and overnight visitors, and just showing that locals in those selected counties, in many of these categories, the number of contacts that they're having, number of new contacts that they're having, The percentage of time in restaurants, percentage of time not at home, they're under the statewide average there. But then if we flip over to the right side and look at the selected counties and the overnight visitors and the activities and percentage at which they're engaging, it's really a lot more time in restaurants, a little bit more time in retail establishments. And then down here where we see contacts per device, so they're having more contacts and more new contacts per device than locals. And so, I think this information really helps us to understand our local context and why we might be seeing different trends and different transmission patterns in ski counties than the other counties in the state. Okay, next slide is our recommendation. So our recommendation still is to align with the state dial and to use the state dial metrics. So this would be a departure from the last public health order that was passed, where this board really established some independent measures to move into the red level restrictions, and decided to use our own data to do so. I think that the state dial does bring some level of consistency, and I know that there'll be lots of discussion around aligning this recommendation to align with the state dial and to use those metrics. What we also would recommend is that we retain those measures that are independent of the dial that we've long established in Pitkin County, ranging from clarifying gathering requirements and how those also apply to our lodging establishments, the traveler affidavit that this board was a huge proponent of, quarantine and isolation requirements, our public health order really just gives some authority to having everyone follow those requirements. There's some language around the requirement of informing guests about the current restrictions in the county before they visit. Our local public health order gives the authority for the business and event safety plans to be completed and followed. It also outlines the requirement for compliance with case investigation and contact tracing. And also we have a local face covering requirement that we want to make sure that's in place because we know how important that is. So I will pause there to see, and just go back to the previous slide to see if there's discussion and how the board would like to move forward with the adoption of the new dial.
Okay, so Jordana, the recommendation coming from staff would be that we would align with the state and follow the new and improved dial. Is that correct? With the other and parts of it we would retain. Let's first talk about the state dial and your thoughts, and then we'll go into retaining the other requirements. Do I have any hands? Any questions? Yeah, Tori.
Thanks, Marky. I guess I do have a couple of questions. Number one is about the movement to more restrictive levels. I have a concern about what the wording there was, moving swiftly. The difference between moving down in levels is a 7-day average, but you can be put into a higher restrictive level in 1 day. And I just have concern about that in communicating that with the public, enacting that, enforcing that compliance in a 1-day turnaround. Can somebody speak to that? I mean, how are we going to get that messaging done correctly? you know, I guess I'm asking for what does that look like? You know, I think that we need that ability to communicate those changes to the public so that they can be following them. And so can somebody address that about moving to a more restrictive level? What sounds like it could be a 1-day notice, an afternoon notice. I'm just unclear about that.
Great question, Tori. I've got the same question. I'm sure many of you do. So Jordana, can you enlighten us on what does swiftly mean?
I think we are still waiting to get more direction from the state on that, Tori. So while I think we have concerns and we want to be able to message this to our community, we are not able to be less restrictive than that language. We can always be more restrictive than the state requirements, but we can never be less restrictive. So, you know, we'll continue to find out more as we meet with the state, as they go through this process of moving a county into a more restrictive level. And we have a model. We'll kind of understand what that swiftly time frame looks like. But that's just unfortunately as much information as we currently have.
And Jordana, I guess you're saying that hasn't been deployed yet. The state has not moved any counties up a level according to the dial yet.
To my knowledge, right? Just because they started this on Saturday.
Okay. And then Marky, the other item that I wanted to bring up was some information about the traveler affidavit. You know, we were bold in Colorado for us to enact a testing requirement coming into our community. And I just was wondering about how effective has that been for us? I am wondering when we might have the discussion about removing the traveler affidavit. And so I'm wondering both things from our county health team. How do they see the affidavit as being effective in everything that we've been doing? And then when would we be having a discussion about removing some of the requirements in the affidavit?
You know, that's a very good question as well, Tori. And what I'd like us to do is pause on that particular question until we answer the question about following the state dial. To me, following the state dial makes a lot of sense. It gives us a lot more elasticity. It allows for some of our businesses. And right now we're clearly in yellow. And if we could get some of our businesses going to 50% capacity in restaurants, I think that would speak volumes to our community. So I don't know where other people are. That was just my editorial comment. Tom, I see your hand up. Appreciate your comments as always.
Earlier, we had the comments that counties in Colorado less than 30,000, which with a smaller population, you can have more variance. Like on one day, you might have 15 cases, the next day you have 2. So on the day that you would have 15 cases in this 1-day ruling, that could be rather harsh, that you could be ruled upon that day. So I will point that out, that is a consideration for all of us. And secondly, I certainly agree that with a SIR of 135 today and a positivity of 2.8, that we can go into the yellow. And I would encourage that. And at the same time, point out that the restaurants that have registered for the 5-star program should be rewarded by having their names published so people can see the 5-star participation and go to those more compliant restaurants.
Thank you, Tom. Very excellent comments. Patty, I saw that you had your hand up, and then I see Greg Postman's hand up.
Okay, thank you. And I'm sorry if there's lawns being mowed in the background, but I'm in California with my mother. Yeah, I support following the state on these issues. I definitely support moving into yellow as rapidly or swiftly or whatever that term was as we can. And when Tori brought up the issue about the traveler affidavits, we did get an email from Debbie Braun with ACRA asking us to have a discussion. And just in case I have to get off, Marky, that might be a good round robin discussion for our next meeting to actually bring forward the information we've learned from our traveler affidavits. I think that would be a great idea. I just did receive a thing from United Airlines advising me about testing, getting off the plane in Aspen, which I was really impressed to receive in time. Actually, I got it the other day in time for me to get tested coming home. But yeah, I definitely support the direction of the recommendation, and I'm really happy to be doing so. It's great. I think we can all come together on this and move forward. Thank you, Marky.
I found that humorous when you said they're mowing the grass. I'm thinking, where are you? But take care and make sure your mother's well taken care of as well, Patty. Greg?
No, if I have my hand up, I can't tell, but yeah, I think our board, certainly the Board of County Commissioners, is certainly interested in aligning with the state dial and moving the way the state moves. Basically, because it'll be hopefully much easier for everyone. But we have our eyes open about the elasticity maybe causing abrupt changes. I guess we're just gonna have to be used to that. But I think we're supporting that. And I certainly will vote for it.
Okay, well, I think we've got a kind of consensus here, but we would need an emotion accordingly about following the state dial. So do I have a board member willing to make such a motion? Greg?
I'll make that motion.
Okay,
I'll second it.
thank you. So the motion is to immediately adopt the state dial. Is that correct? Okay, all in support, raise your right hand. That is unanimous. Thank you very much. Okay, let's go back to that slide. Jordana, if you can pull that back up about those other, let me get there. Yep. My computer's acting up a little bit. Okay, Jordana, can you lead us through this conversation?
Sure. So these are the other requirements that we have had locally for varying amounts of time that would be put in place regardless of the dial level. So these are what we would propose is just drafting a new clean public health order to carry over these aspects of our what we have in our current public health order that still would apply regardless of dial levels.
Well, you know, I don't remember from one meeting to the next meeting exactly what these are. So what's gathering requirements? What's the number? Yeah, if you could do that. Patty,
Okay.
do you have your hand up first or?
That was the question I was going to ask, Marky. What's the gathering requirement number? I also can't remember. Thank you.
So the gathering requirement here would say that we're aligning with the state dial on that informal gathering requirement, which in most levels is 2 households or 10 people. But in the red level, it goes to 1 household. Those gathering requirements apply to lodging situations. So that is something that the state that's intended, and we just clarified it in our local order because it was not clear in the state order. The traveler affidavit, I think, is pretty clear what those requirements are. Quarantine and isolation just require, let me just pull this up. Quarantine and isolation are requiring that you will follow the directions that you get from the Pitkin County Public Health Department, and that's basically it. The business and event safety plans. So way back when our response to the pandemic started, we required every business to complete a safety plan. Also, we later on required events to have a specific safety plan. And so we included that in our public health order to make that official. Compliance with case investigation and contact tracing basically outlines that if you are contacted as a positive case or as a contact, that you will engage with our case investigators and contact tracers. And then finally, the face covering is that, face coverings will be worn outside whenever there's a risk of being within 6 feet of another person, or when indoors. And outlines the exemptions there as well, and some requirements for business posting information there.
Okay, any questions on these items? Jordana, one thing I missed when we talked about going into the and moved and approved, moving into following the state dial and moving us into yellow, when would that become effective? I apologize for not asking that question.
That's on the next slide for a decision.
Oh, okay, well, we'll wait for that preview. And any discussion around these retention of these following items? And back to traveler affidavit, I think we'll hear a little bit more about that during round robin. That would be a good topic for our next meeting.
Yeah. Marky?
Yeah.
Yeah, it's Ann. Jordana, thanks for going through those. Which of these are not part of the new state dial, say the new orange, or where do they fall? Orange or yellow in the state dial?
So all of these apply regardless of the dial level. So these are just additional clarifications we've made to the public health order over time when we saw that the state public health order didn't necessarily address these they don't address them. The state doesn't require business or event safety plans. We require those locally and have found those to be extremely helpful with our robust consumer protection program. The state doesn't have specific language around compliance with case investigation and contact tracing. So we, at some point, put that into our own public health order to make sure that to just specifically outline that authority that we have and let the public know, what the expectations are around that specific issue. So all of these are not tied. They're not necessarily tied with the dial level.
So they're all more restrictive than either the orange or the yellow dial.
They're more restricted. Yes, I guess they're more detailed than what is outlined in the state's plan, the state's public health order.
Okay, I'm just trying to get to, if we really want to align ourselves with the state, we'd lose all these things. We would get rid of all of them, correct? Because they don't align with anything the state is asking for currently, correct?
Yeah, these are above and beyond what the state order outlines, although I think our face covering is pretty synonymous with what the state requires. We just wanted to make sure that if the governor lifted the face covering order at any point in time, we would already have that in our public health order.
Okay.
And some of them, they've all come up as issues that we have had locally that we've wanted to address, and this has been where they've come.
Okay, face coverings, that's where I was getting confused, but that makes sense. Thank you very much.
One question.
Any other questions? Yeah, Brent?
Just real quickly, how many other counties use local data? Do any?
I would say nearly all of the counties are looking at their own data.
Yes, but they're all, but I should say, let me put it another way then, how many counties don't adhere to the state dial?
we are required to at least follow the state dial. We can always be
Correct.
more restrictive. So if
Okay,
we
well, yeah, then how many counties then deviate from the state dial? That are more restrictive than the state dial?
I don't have that number offhand, but I know many counties have additional local public health orders that
Sure.
that have, yeah.
Okay, well, the only thing I was getting at is, I mean, I guess, is that it certainly seems to me that the state dial politically is easier to defend. You know, you've got the state behind you. It makes it much more simple. And if we decide for whatever reason to become more restrictive, you know, but that's great. But I think the state data is, you know, seems arguably the more easier to defend. That's all.
You know, I'm just looking at each one of these individually now and looking at gathering requirements. We do know that if we lifted gathering requirements, we do know that we would probably experience spread. So I would not support changing the gathering requirements under yellow.
Yeah, and I didn't mean to, if I
Yeah.
suggested that. No, I wasn't suggesting that at all. In fact, everything that I've read basically says that we're in the lull. We're not completely sure why, and that's just not Aspen. That's even the whole country.
Right.
We got to be careful that we don't, you know, the old wake up on third base thinking you hit a home run scenario. So
Yeah.
So anyway, I'm in favor.
I'd like to point out that face coverings in quarantine are certainly on the state dial. So this is not necessarily
Right.
unique to Pitkin County.
Right.
As well, Pitkin County as a resort and ski area is unique. We're not the same as Denver. So these can apply to Denver, and Aspen as a ski area can have its own unique plans as well.
Right.
Okay, any other further discussion on these items? Yeah, Greg?
Yeah, thank you. Just looking at this list, that it's a pretty it's a pretty big list, and I see the points for everything here. I see that some of these things do align with the state. I'm just wondering if we can simplify this. If face coverings are required, I just want to make sure people understand that it is aligned with the state, but we're retaining our own rule in case the state relaxes theirs. So all of a sudden that would change our status. That's what I thought I heard you say, Jordana. Regarding compliance with investigation and contact tracing, it's like, yeah, well, people should do that. I don't know how we can enforce that or do any better, but I guess it's worth mentioning. The thing that's going to be the most difficult are going to be the gathering requirements. And if the state isn't doing that, I'm kind of surprised. Is there any way we can be a little bit more specific about these so people understand just what it is we are doing and if it's that much more restrictive?
Yeah,
that was a question mark. I'm trying to articulate it properly.
Yeah,
that's a good point, Greg. I think a lot of these aren't more restrictive. They're just more clarifying. The traveler affidavit is certainly more restrictive than what, that's very unique and is not, there's not a corollary at the state level. The gathering requirements is just a clarification. Quarantine and isolation requirements, again, that's just a clarification, that those will follow what is deemed necessary in Pitkin County. If you get an order, informing guests that this was, informing travelers of some of the requirements before coming to Pitkin County. This was really put into place before the traveler affidavit, and was, a nod towards how we are different than many counties in the state, in that we do see, as the mobility data showed, a large number of travelers, and we know that them being informed of what the status is when they're coming to our county, and what the the requirements is important before they get here. So that is part of why we have included that, and it's not included in the state. Again, business and event safety plans we require, which is not required at the state level, but I think that has been a really helpful tool for our robust consumer protection program. And then compliance with case investigating, contact tracing, that is, again, it's a clarification. It's no different than what you're expected to do anywhere in the state. Face coverings, again, is aligned with what is required, but we just wanted to also ensure that we have that locally in case for some reason that was the governor signs those requirements on an ongoing basis, but we wanted to make sure that we had control of that locally if for some reason this was lifted at the state level.
Thank you.
Any further discussion? Okay, I don't see any hands. Yeah, Tori?
Yeah, I just wanted to come back to the traveler affidavit. Again, I'm wondering about its efficacy, and I'm wondering about when we would be removing that. It is something that we are doing that others are not. And I just don't know if that's, good decision making there or not. I really would love some more information about what we think that we're achieving with it and if we should retain it. And if that's not the direction for today, because we don't have that information, I'd love to get that information and start having that conversation around what are our expectations for retaining the traveler affidavit.
Tori, I think that's a very good point, and I've already put it on a draft agenda for 2 weeks from now to make sure we have some data on the effectiveness of a traveler affidavit program and kind of the pros and cons, and really look at it from a data-driven perspective, as well as what we're hearing from the lodging community as well. Is that reasonable?
Yeah, absolutely. I agree that we need the information around it before we can make decisions on it, but yeah, thank you.
Okay, so perhaps what we do right now with the new order that Jordana is going to be putting together that would come out for implementation on Saturday was retaining all of these items that she has so eloquently listed and provide, to me, most everything's clarification. So are we comfortable from a consensus perspective? Can we just do a consensus on this? If you're supportive, just raise your right hand. Okay, I think we're good there. Okay. Jordana, do you need any other clarification there?
No, that's helpful. Thank you.
Okay.
Marky, real quickly on that, I was not raising my hand there. I was wondering about, this is scheduled for 9 a.m. I guess what we're saying here is that a new public health order would put us in level yellow restrictions effective Saturday morning. I'm wondering why those would not be in effect tomorrow. Tomorrow would be our 7-day yellow level in our incident rate.
She might have,
why we wouldn't not institute those changes for tomorrow?
might have to write the order. Jordana,
Go to the next slide. We can discuss that, Tori.
All right, thank you.
Okay.
So if we continue to meet the yellow level metrics through Friday, according to the state, we can then move to the yellow level dial on the dial as early as Saturday. We would need that 7 days of our incidents in yellow to be able to qualify. So our recommendation is to, if we do continue to meet the criteria through Friday, to be able to move to yellow on Saturday, and then going forward, be able to review data at Board of Health meetings for any potential upcoming changes and check in with the board if it's, the data is trending either in a less restrictive measure, less restrictive way, or if it's trending up and we would need to move in a more restrictive way to have that check-in with the board about what the plan would be.
Okay, so we do need to get through tomorrow in order to make this happen on Saturday. And further discussion, if not, I'll ask for a motion accordingly. Greg? Greg, you have to unmute.
I move that we follow Jordana's recommendation.
Okay, thank you,
I
Tom.
just wanted to clarify. So it's administrative. As soon as we hit yellow, we go yellow. We're not going to wait for a document to be prepared and written, right? If we satisfy the state's requirement as of by the end of the day tomorrow, beginning of the day Saturday, we're in yellow. Is that what I heard?
Jordana?
Yeah, so by aligning with the dial, we would follow that process that was outlined in those blue slides, that once we hit 7 days in the less restrictive capacity level, then we would move the following day. I think in the slide, it says we just have to consult with the state because they actually move us on the dial, that their data matches ours and that we're moving.
Okay, so we'd have to hear it from the state, but they're going to be watching and paying attention to this because they know how important it is. I did have a question that came regarding, is the 7-day metric cumulative or consecutive? 7 days, yeah, it sounds like it has to be 7 consecutive days, correct? That's okay, there's the answer to that one. And it's same day if the state responds quickly, and we're going to encourage them to be responding immediately.
Yes, I've already been in communication that we're meeting today. The board's deciding on this, and that we'd like to make sure that this is on their agenda. And if our metrics hit, and this is what the board decides, that we would want that dial level moved.
Great, thank you.
Okay, so we do have a motion on the table. Jordana, second part of that, when you're talking to the state, tomorrow, can we make sure we get a definition on swiftly?
I can ask.
Okay, come on. But we do have the motion on the table from Tom that we would follow the staff recommendation on the slide we saw. So do I have a second?
I second it.
Thank you, Linda. All in support, raise your right hand. Oh, we don't have unanimous here. Tori?
I was just going to advocate for moving to yellow tomorrow instead of waiting till Saturday.
Well, the state has to move us, so that's just not an independent. So, okay, so we do have the majority of the board moving and following the staff recommendation for Saturday morning. And Jordana, it'd be wonderful after you talk to the state tomorrow, could we send out a quick note to all the board members? And probably the press will be most interested as well, so.
Yes, Marky. So we've got our process, and Kara, if you're on the call, I don't know if I see you here, but feel free to jump in. Our comms team has been working on the parallel process of what are all of the channels that when a dial level is indicated that message needs to go out on, and how we can do that as quickly as possible.
I saw her on earlier when I was checking the attendees. I don't, okay, let's just, let's be clear. We do have a process in place that the staff has put together on how we roll out the communications. So let's move on the agenda. And this will be Suzuho talking about the dashboard update.
Great, thanks, Marky. We are very excited to have our new dashboard released as of Tuesday of this week. So I just wanted to spend a few minutes going over it with you all. So I'm going to try and share my screen here. Is that coming through for everyone? Okay, great. So you'll notice that there's a couple different areas where we have some changes. Our intent behind these changes was to really be able to provide more robust data to the community, as was requested by the Board of Health 2 meetings ago, to make sure that everyone's working off of the same data. So on our dial page here, this should look familiar to you. And then these 2 graphs here are new additions. So with our incidence rate and our positivity rate, we are transitioning this to a 7-day incidence rate and 7-day positivity rate. So these are a couple changes here with this new platform that you're using. If you're ever feeling like these graphs are too small, you can always click on this top right button to expand it as well, and you'll be able to see that a little more clearly. The bigger changes really are on our case dashboard here, and huge kudos to John Anderson as well as Andrew Shoemaker from our Business IT Services Department and Nick Calderon from our communications team as well. The 3 of them were integral to getting this up and running, and then all the future dashboards that are coming as well. But hopefully it's a cleaner, more robust dashboard for everyone to keep track of how we're doing as a community. You'll see very familiar indicators up here at the top, generally around the cases that we've had in the community, which are individuals who have tested positive for COVID. And then this next graph includes our 7-day incidence rate. You can go through each of these tabs as well, which have additional data. So this is the cumulative daily cases by lab results, our local incidence rate, and then our 7-day and 14-day case counts. We'll most likely move away from this 14-day case count as the state transitioned to the 7-day timeframe, but we just wanted to leave it up for a little bit longer as people are monitoring this and kind of transitioning how we're viewing the data. If at any time you wanted to change this, you can also just get rid of one of these by clicking on these buttons. And you can also use this slide to narrow or broaden the date range that you're looking at the data for. Similarly to the previous page, if you wanted to look at it a little more closely, you can hit that button on the top right to expand it and see the data in more detail here. Let's see, so going down to the next graph, you'll see our demographics data. So we have the data by age, symptoms, region, and additional demographics. For each of these, you'll see the total number here in gray. And then for the ones that are applicable, you'll also see our census percentages, just so that you can see that comparison. As we've discussed before, monitoring for equity is really important for our department. So we want to make sure that we're comparing it to some known demographics data for our community to see where there might be disproportionate impacts on certain communities. You can also click any of these on or off if you wanted to have it a little bit more simplified or just look at one data point at a time. So that's the data by age. We have it by symptoms here as well, by region, and then additional demographics by race, ethnicity, and sex. So these are the main kind of case-related data that we have. We had a second page previously for our Protect Our Neighbor metrics. We wanted to consolidate this and put it all on one page. So if you scroll down, you'll see the metrics that are required to be met for us to be qualified for the Protect Our Neighbor level. So hopefully at some point we'll be able to apply for this. A lot of these metrics should all be familiar, but just a revamped look on how they're being presented. So transmission, test and trace, and then the additional local metrics that we were previously presenting as well. So just a little more cleaned up again, but the indicators have not changed. So this is exactly the data that was presented before. Starting next week, our team will be adding new indicators around vaccines, and then each week kind of subsequent to that, we'll try and roll out some additional metrics as well. So everyone should be seeing some changes to this over the next probably 2 months or so as we continue to add more data that many of you have been seeing on the daily update PDFs that are emailed out. So we can transition away from that and onto this website dashboard that's more accessible to everyone in the community. I also just want to highlight that Nick and our translation team have done an amazing job with ensuring that all of this is accessible in Spanish as well. So by clicking on this button up here at the top, So for Spanish, all of this information is also accessible in Spanish as well as English. It does take a minute or two for the dashboard to load up because there's so much data back there, but should load up similarly to how it was before. Any questions?
Any questions for Suzuho? That presents very nicely. Well done. Okay, moving on. Now we get into the fun stuff called vaccinations. We're so excited throughout the community, as we've heard from so many of our neighbors and individuals who really have enjoyed. I hate to say it, I never thought I'd like getting a shot as much as I did to get my COVID vaccine. So Jordana?
Thanks, Marky. If you're advancing the slides, if you could just go back one. I just want to share some of these photos. These are real photos from our local Pitkin County team who has been working at the mass vaccination clinic. And that was just recently updated on the website, and I noticed it and just thought it's really exciting that we could share these images from the event. The next slide shows the overall vaccine priority levels and phases for distribution as determined by the state. So as the board is probably well aware, we are required to follow the phasing that is determined by the state. And as such, we have locally been able to work through this first phase of 1A. Our highest risk healthcare workers and individuals have been vaccinated this week with the additional vaccine that we were informed Monday morning that we were receiving, what is called a pizza box worth of Pfizer doses. We were able to also really extend vaccine appointments to all those Coloradans age 70 plus in Pitkin County who had expressed interest in receiving vaccine, as well as the remainder of our healthcare workers and first responders in that category. So we're really excited to be through those top two priority levels locally. The next level, 1B2 of priority, is Coloradans age 65 to 69, which several hundred of which also have an appointment starting tomorrow in our Mass Vax clinic. And also we are thrilled to be able to have covered our pre-K through 12 educators and childcare workers from licensed childcare facilities and programs appointments tomorrow. So I think everyone who wanted a vaccine in that group, except for a handful who weren't able to make the schedule of tomorrow, are in. So we are really excited for that to happen. And then also this last category of the continuity of state government, we've got about 6 workers in our judicial system who qualify, and we're able to access appointments for tomorrow. So that's where we are at. If we look at the next phase that's coming our way, 1B3 is the frontline essential workers. That includes those that work in food and agriculture. We have been informed that the food definition expands to include restaurant workers in 1B3, both the front and back of the house, as well as those from the U.S. Postal Service, public transit, grocery store workers, public health and human service, frontline essential workers, faith leaders who are on that front line of interacting with folks, and direct care providers for Coloradans experiencing homelessness, as well as frontline journalists. So that is the next phase where we're really working on doing that planning and figuring out priorities within that with our policy group, and the process for being able to work through that next. Next slide.
Marky?
Yeah.
Yeah. Jordana, can you go back to the previous slide?
Sure.
Sorry. Just a real quick question. I've had quite a few inquiries about people with either developmental or physical disabilities. And there doesn't seem to be a category, but they are at increased risks. They have vulnerabilities that other people don't have. So where would they fit into 1B.3? Where do they fit in here?
So, and this is something that we know that folks locally have been advocating for at the state level to understand where they fit, because right now, as you're seeing, that they don't have a specific, they don't have they're not called out specifically in a category for folks with disabilities, unless there are any of those high-risk conditions that are associated with that condition.
Okay, because many of those disabilities, the high-risk conditions just becomes part of their condition. What kind of avenue? What can people, anyone from Down syndrome to some type of traumatic injury, what can they do to try and get a shot?
So Carly, I'll just see here if you have any additional information on where folks fit in this category, or if we don't have any specific information, we can ensure that we look this up and include it in our information and FAQ.
And also, if we could advocate at the state, because like I said, the people with these conditions are more vulnerable to either getting it and suffering more greatly from COVID than some of the other people down further in the chart.
Yeah, hi. Sorry, jumping in real quick. Jordana did a great job of kind of discussing this, and that the state really hasn't set too many guidelines around this population. So I do think that's some advocacy from the state, and at least asking for a clarification, just because I know that they're probably thinking about it, just might not be as distinct as kind of adding it into this flow chart necessarily. So definitely something to note, and that I will bring up with them in the calls going forward. As far as accessing the clinic, we are working directly with sort of our access and functional needs partners to make sure that we can provide those that transportation requirement, that assistance with that registration and appointment forms that we know are online right now, and that is a barrier, especially to certain groups. And so kind of expanding those capacities to be able to target and make sure that we're meeting those needs is certainly something that we worked on this week. And going forward, that kind of work never stops. And so as we move forward, we will look to expand that. We're working towards mobile clinics. We're working towards kind of working with all of our different partner organizations to help identify and contact and engage with those communities. So I hope that helps.
Thanks very much. Yeah.
And as I'm hearing you speak more and reading down into the phase 2, in this middle column here, they are calling out individuals with Down syndrome, and then at the bottom, people with disabilities that prevent them from wearing masks are indicated in phase 2. So if there are other specific.
Okay.
Does that give you the information that you need, or do we still need to ask for clarification?
Yeah, sorry, I hadn't read down that far. So
I do also know that they also included those conditions in phase 1B3, as long as there were 2 of them. So if we're talking about those kind of comorbidities, and sometimes conditions exist together, they do call that out in phase 1B3 as well. I think it's just the single conditions that are,
okay. And is this chart available on the website, Pitkin County? Okay, perfect. Thank you very much.
I know that our data team is working hard to pull some of this information together in the dashboard that will be coming out next week around vaccines. But just wanted to share some numbers that we did have. And I think overarchingly what this chart shows is that how greatly our Allocations have varied from week to week. So you'll see the week of, January 9th, we had about 100 doses of vaccine. The following week, we had over 1,000. Back, the following week to a couple hundred. And then this week, we are back up to over 1,300. So that's the variability that we have been working with our allocations at the state level, and just want to again commend the effective collaboration of Aspen Valley Hospital, Community Health Services, our public health team, the incident management team, Mountain Family Health Centers, all really coming together to coordinate the vaccine that we're able to get, and then how we're going to distribute it in the community in a coordinated way. This has been really a huge asset, the partnership and collaboration that the vaccination effort locally has exhibited. We're very lucky to have all the partners at the table that we do. We expect pharmacies to also be joining that effort as they might be getting vaccines from federal programs in the future, to be able to continue that coordinated effort at the local level. And so I think that to me is one of the biggest takeaways from there.
Any questions?
Not a question, but I'd just like to put an exclamation point after Jordana's statement about the collaboration. I know Jordana and her team have opportunities to talk to other public health departments across the state, and we do as well, have the opportunity to talk to other, in particular, rural hospitals. And I don't think there's another community in the state that has the power that has been amassed here between all of these agencies working together to get these shots administered very efficiently and effectively. So I applaud the work of Jordana and her team in pulling together this amazing collaboration. So I'd just like to thank you for that, and assure you that our community is well served as a result.
Thank you, Dave. That is so true. And it's so wonderful to see so many wonderful faces as you pull into that tent that and somebody giving your vaccine that used to work for you. It was great to be over at the tent. And I don't know how they got the parking lot ready after a snowstorm, but boy, I'm sure Public Works worked very, very hard to get that parking lot and everything ready to go. So to John Peacock, and sure he will thank all of the members of his staff doing yeoman's work. So thank you all so very much. Any questions for Jordana? I guess the question is, how many are we getting next week?
That is the $1 million question. We will know Friday or Monday morning, apparently. But there's a couple more slides here just to go through. I think I just wanted to share, on the next slide shows the weekly vaccine process that our team has been really working hard to adapt and fine tune. If you could go to the next slide, it just walks through this rhythm that the team has been really hoping to work with and achieve. So knowing that on Monday, there's an email notification that goes out to all vaccine notice registrants. So everyone who's signed up to be kept in the loop, it lets them know if they're eligible for a vaccine this week, the number of doses that are available for the week, and when registration will open for their category. The highest priority category gets notified first as to when they're going to be able to register for an appointment by both email and text, and then individuals can go in at that time and register themselves. And then it opens up to the next priority of eligibility a short time later, again with an email. And this was the first week that this was the first really test of working with, workers in a specific category in this new system. And so our team did a lot of outreach to figure out who the point of contacts were with each different either childcare or school related entity that was eligible for vaccine this week, so that we could communicate with them and they could communicate with all of their staff. They got sent a special link to be able to sign up. There were gymnastics done as to how everyone was going to divide up the time slots that were available. And I mean, just continues to show this really incredible mentality of working together all towards this common goal. And then finally, there was an additional round of opening up to those that were the third priority. And then the ability for them to register. And then what I think is a really fantastic development that the team has worked through is that once slots are all filled up, all appointment slots, there's an option to be able to sign up for a wait list. So if you go to register, all the slots are full, you'll have the option to, some folks register for this wait list, which helps us to deal with the uncertainty of the number of, sometimes you can get extra doses out of the vaccine vials, but you never know exactly how many you're going to have or if there are no-shows. And so our team has really built this into the process so that we never waste a dose. Those folks that are on the wait list are prepped and ready to be close by and by their phones. If there is a dose that's available, then they're called up and they are already qualified for that priority level. So it's a really elegant process to ensure that we don't waste a dose and that we're getting it out to those community members that are in that priority level. So Carly, I'll go to the next slide and ask if there's anything else that you want to reiterate that I forgot. And I just want to make sure that folks know that you can go to the covid19.pitkincounty.com website. You click on vaccination, and right here you'll see the steps 1, 2, 3, 4. Under step 1, you can sign up for COVID-19 vaccine notices, and that will put you on that list to be notified every Monday as to if you're eligible to receive a vaccine, and in that queue to sign up when you are eligible.
Okay, any other comments? Tori, please.
Thanks, Marky. Jordana, I was contacted by a local limo company, and they were reaching out, wondering if there was a need for transportation for people that are scheduled for vaccination, but may have a difficult time getting there, etc. Can I get this person in touch with you? Maybe there's an opportunity to utilize this service for people that need transportation to get to their vaccination.
Sure, and Carly, I know you've got more details about all of the partnerships that have been going on to especially address folks with access and functional needs and getting them to this mass clinic site. But yeah, Tori, feel free to pass it along to me, and I'll pass it along to our team to input them into the process.
Great, thank you.
Okay, any other questions for Carly or for Jordana? Okay, let's move on the agenda, but good job. Excellent work. And I'm so proud of the team that has made this so smooth. When you see the pictures of Denver doing their mass vaccine, they should come to Aspen and see what we're doing here, because this is yeoman's effort. So let's move on. And the next item on the agenda is the 5-star update.
Mark,
And
real
this-
quick here.
Yeah.
sorry, a question just came in for Jordan, and I think I have the answer, but I want to make sure that all teachers are eligible starting on Friday. Is that correct? Not just pre-K, early education. I think it was, I went and looked at the site and it was a little unclear, but I believe it's all teachers are eligible to get on the list. Is that correct?
Pre-K through 12, and then anyone who works at a licensed child care center.
Excellent, thank you. And that includes substitutes as well.
Carly's nodding, so yes.
Okay, thank you.
Okay, next item on the agenda is the 5-star program. And Jordana?
Thanks, Marky. If we go to the next slide, this will just reiterate that how 5-star interacts with the new Dial 2.0. So 5-star businesses are still allowed to operate one level lower on the dial, except they may not operate in Protect Our Neighbors unless the county is formally in Protect Our Neighbors. And then additionally, 5-star businesses and counties in level yellow, which hopefully we will be as of Saturday, may not operate at level blue restrictions until Colorado has vaccinated 70% of individuals age 70 and over. Again, the goal for the state to do this is at the end of the month. And as of Saturday, they were at about 64% of their goal of 70% of individuals 70 and over. So they're a little over halfway there as of Saturday. We go to the next slide. Again, this, I just want to talk through, some of the benefits of applying for 5-star and becoming certified. So even though once we move into yellow, folks won't immediately be able to have any additional capacity. What it does is really allows for that capacity to happen in the future. So whether in the future we are still solidly in yellow and the state has vaccinated 70% of 70 and olders, folks 70 and older, this would give those businesses that capacity to operate at level blue allowances when that does happen. On the other hand, if we do move up into the more restrictive orange level, and we are in that solidly in that orange level, it would allow those businesses that have gone ahead and become 5-star certified to continue to operate at level yellow allowances. So, the 5-star program will have benefits as we continue to move through this dial. And as we mentioned, move through this dial and move levels probably a little bit more quickly than we've been accustomed to with the first iteration of the dial. And so, thinking about that 5-star certification might help bring even a little bit more stability to businesses who are able to be certified. Craig?
Yeah, Jordana, I just wanted to make sure that we underline and put what you just said in bold, that if the restaurant community, I think we have 50 plus are already in 5-star, but if anyone is still hesitating, this is going to be the way forward if they want to have some resilience in the face of the elasticity of this changing dial. There's no guarantee it's going to keep going down, right? And if the state jerks us back up to a higher level, this provides some certainty to the restaurants that they can at least keep operating at the lower, or more open level. So I just want to make sure we really encourage everybody to do this. Let's just be safe and get into the program.
Jordana, how many restaurants or businesses have applied for 5-star? And how many have been certified? What's the most recent number?
Great setup. Let's go to the next slide.
And no, I haven't seen these slides.
You'll see that we've received 71 applications. We made it known that restaurants were going to be prioritized in this process. So that's, probably why 64 of those are from restaurants, 5 from gyms, 2 in the personal service category. As of this morning, 37 restaurant applications are still in review by those administrative committee members. What we're finding is the 5-star program requires some information around ventilation improvements that the businesses are required to demonstrate, and that this is something that many of the applicants were lacking in this information. So we've used that opportunity to be able to reach back out for the information that we did need and to update our application to make it more clear as to the information that is necessary to be able to be certified. And then we do have 29 applications who have been invited to schedule an inspection. So that's the next step in the process is once the application is reviewed and the paper application looks good and we have all the information we need, then an inspection is scheduled and a consumer protection specialist will go out, conduct that inspection, and then the business passes. Once the business passes that inspection, they become 5-star certified. And then we have to wait until we're actually eligible to see if there's any additional capacity that they would gain from that. But that is the process. And so we've got our internal timeline of really the end of that month, aligning with what the state is saying when they think that they're going to have 70% of 7-year-olds vaccinated. We want to have everyone who has applied to this program have gone through that process, so that when we're eligible to have additional capacities, that we're teed up and ready to go there.
Could I just ask about the turnaround time on the applications for the inspection?
So let's see. Raleigh, if you are on the call, I don't know if you have that information yet or if we're still kind of determining the process.
Yep, just to clarify, so the turnaround time from review to inspection, is that what I'm understanding?
Right, just I think that the concern is that it's an expedient process. So when it looks like we're going that direction, people can, get it quickly.
Right, of course. So, after last Board of Health meeting, that Monday, we started to review applications. And with that being said, like Jordana said, there was a few applications, or a little more than a few, that just had some incompleteness to their application. Once the administrative committee does approve of that, I think, it will be a more efficient process as the team members get more comfortable, but it has been taking a few day turnaround time for our team to reach out and set up an inspection time, and then hearing back from that business to set up a time also takes a few days as well.
Okay, thank you. Other questions? Okay. Jordana, do you have more slides?
No, that's it. We've got more time this week for round robin than we have had in the past.
That's just wonderful. I'm so glad that we've moved through the agenda and now it's time for round robin. So I'm going to ask the board members to be prepared to share what people in the community are very concerned about or very positive about. So who would like to go first? And this includes alternates as well to the board. And I see John Peacock may be on the phone call as well. I'd like to hear from him at some point about state and federal and where the Biden administration is going with all the vaccines, if he happens to know, because I'm trying to follow all that data as well. Who would like to start? Tom, I think you had your hand up first.
First, I'd like to reward the people that have been involved with the vaccination effort. It has been tremendous, and I think we'd like to continue to encourage that. Second, I'd like to encourage the turnaround, as Greg has pointed out, with the 5-star program, so as many restaurants and other businesses can get approved and the public knows about the efforts that these 5-star applicants have made and can patronize those establishments.
Okay. Anybody else? Yeah, Bill?
Yeah, I'm very encouraged that the staff recommendation is to follow the state. I think that just takes a tremendous amount of pressure off of public health. And Jordana and our team have done such a great job in getting that message out. I think it's really important that we follow the state and follow that recommendation. It really takes pressure off of local health without having additional restrictions. I'm also curious to know about the additional restrictions we have on our public school and what we plan to do moving forward so that we can align more with those districts that surround us.
Who can speak to the schools? Jordana?
Yeah, Kurt, I can start, and then I know that you've been a major point of contact there. So, you know, we've been working with the schools on a number of things that I think the list started really growing towards the end of December as to all of the things that we were going to be working to put into place in the new year. So we worked on guidance to align the new quarantine guidance that came out from CDPHE around shortening that quarantine from a period of 14 days down to 10 days or 7 days with a test between at day 5 or later. And so that's a protocol that we have worked successfully to put into place. And I think have shortened it to 10 days for students. Students can still test out earlier, but as they are being held to that 10-day quarantine before coming back to school. And then Kurt, maybe you can follow up with where we're at with that quarantine protocol for staff, because I think that was under discussion about whether that was going to be a difference. I'll also turn it over to Kurt to talk about the targeted contact tracing that's going underway at the school that we've been working on processes and protocols with the school about. And additionally, let's see, the last thing, we've been working hard with the schools around understanding the new guidance and variants that's been coming out from the state around the CHASA guidance variants and how that gets rolled out.
Yeah, thanks, Jordana. I think you hit on most of the pieces with quarantine. We had been discussing quarantine with the school around teachers, but as part of the targeted tracing desire as well, we've left the quarantine right now with the teachers at 10 days, wanting to take some additional steps sequentially, just each at a time, so that we're not changing multiple variables. The school really wanted to do targeted tracing first, which we're doing in the high school. And then we've had some conversations. We did a walkthrough with the school last week to look at the efforts. And 7th and 8th grade, we had a couple of concerns. So we're talking with the school about doing some education. I think there's just, we need some clarification on the state guidance around that. So we're working with them through getting that clarification done so that we can look at 7th and 8th grade. And I think they also have a desire to do 5 and 6. I reached out to some others at the state to talk through the junior high piece, because I know locally they're not doing targeted tracing at the junior high level, but I know the school wants to do that. So we're looking for some additional examples to try to help work through that. And then the CHASA sports piece, I know they're now participating. They originally, because of our incidence rates, we were practicing but not having games. That started February 1st. And then the other piece that was just brought up last night that I think the staff will talk about, because we're moving now to yellow, is spectators. We had an agreement not to have spectators given how high our incidence rates were. And then the question became last night that was forwarded to us, well, now that our incidence rates are getting better, what do we do as spectators? So I think the staff, we want to talk through the couple of options there. I think we've heard a few ideas that we want to talk through, which includes things like, do we start out again slowly with, senior parents and let them go, because that's obviously important. And I think we'll come up with those options and go start working forward through those. Does that answer your questions, Bill, or was there anything else specific there?
Okay. Other people? Yeah, Greg?
Yeah, thank you. Just I want to circle back just very briefly on the 5-star inspections. It sounds as if there's a few days for outreach and then a few days for response. Not sure if it needs to be reduced or made more efficient, but is there anything that we can do to reach out to the applicants in the community to incentivize them to get their applications in sooner? So the few days it takes to respond, maybe we can cut that time down a bit. I'm just wondering if that's going to be necessary. And then likewise, maybe if staff has recommendations on how to streamline that process, if it's possible even, I'd certainly encourage that, just so that we get this done quickly and it doesn't seem like it's stuck in an administrative bog. That's the first thing. Second thing is hopefully we'll get some update. I know John was going to talk, we talked earlier about possibly discussing affidavit, not making a decision today, certainly putting it on the agenda next time, but there have been questions about the affidavit. And I think we do have enough new information that hopefully he could add some of that today. And then also, we've got a new ski event coming in, new big ski event. It'd be nice if we need an update on that, just to bring up the topic. Maybe this would be a good time to do that as well. Okay, I did want to note, if I could, I wanted to note that I think we're going to be seeing some national press about the affidavit program this weekend, as soon as this weekend, and it'll be in the positive. And so just look forward to that, and I'll be sure to share it with everyone when I see it. Thanks.
Thank you. John, did you have an update or not? Peacock.
Sorry, I'm having trouble with my buttons here. Give me just a second. Well, I think I've been called out on a couple of items, and so I'll maybe take those in order. First, Marky, I think you had a question about vaccinations and what we're hearing, and we haven't gotten specific information from the state or federal levels yet, but in talking to representatives from the state and their discussions with both their counterparts in the federal government, but also watching what's happening with new vaccines potentially coming online, like the Johnson & Johnson vaccine, that they're expecting to see exponential growth start to happen in the vaccine distribution. And so that would be potentially on a monthly basis, starting to see a doubling every month up to a point. I don't know what that point is. And we're also not quite clear on what our base is on that, because that's changed a little bit. But overall, I think the news is good. And as Jordana had indicated earlier, I think that one of the reasons the state is looking at increasing the folks who qualify earlier in the vaccine priorities is also with an expectation that distribution will improve. So we'll be watching that. There's articles out there about federally qualified health centers getting distributions directly and that sort of thing. We'll see how that plays out. But right now we are still dependent on the state. We had good news this week. I think what we're going to see is that number will go up and down on a weekly basis. So don't get too discouraged if we don't have as big a number next week. I wouldn't expect it. But we're on a good path right now with that. So that's a lot of ways of saying I've heard encouraging comments, but no specific data yet on that. As far as the affidavit, and I think, Marky, you'd already noted this in an earlier conversation with Tori about bringing this back for further discussion and some data related to the effectiveness of the affidavit. I think we have always been of the opinion that if the affidavit could be a state or even national effort, it would probably be even more effective. We're starting to see, some at least talk through CDC and the Biden administration about the possibility of national affidavits and such. In terms of our local affidavit, I think Jordana did a good job earlier in the meeting, kind of talking about the local benefit. And just to put you on the spot, Jordana, or whoever on the phone, I think we're upwards of around 59,000 affidavits that have been submitted at this point. Is that?
I might wait for Kara she probably has access to those most recent numbers.
It's a large number. And so we know that at a minimum, there's a education component that is beneficial there. But I think what we heard from the board is we need to bring back a more detailed discussion. I think in a couple of weeks, maybe we'll have more indication of where a national program or a proposal might be too that this board can take into consideration.
Thank you, John. Any questions for John? Okay, how about other, Tom?
I have a question. Since a lot of us are becoming vaccinated now, will vaccination be a substitute for a test? Because I've heard people are putting together vaccination passports as apps for your cell phone.
So in the guidance that we're getting is that, let's see, so we've updated this, I think, on our traveler affidavit, is that if you've been vaccinated and it's been 2 weeks since your second dose, we're accepting that instead of requiring a test for those that have been vaccinated. The other areas where we're seeing vaccination play into the change in requirements is also around quarantine. So if you have been vaccinated, it's been 2 weeks since your second dose, and you're exposed to someone with COVID, that in many cases, you are not required to quarantine, but just monitor for symptoms. Kurt, anything else?
Yeah, I just wanted to add that the CDC did adopt international travel requirements, and you are required to test at this point, regardless of being vaccinated, if you are flying internationally when you come back to this country. So that is one more piece I just wanted to add. Thanks.
Thank you. Tom, I see your hand up. Yeah, Tom?
No, I was just adding that point so that we take that into account.
Okay. Do I have anyone else in round robin? Yeah, Greg?
There was just one last thing. If somebody could update us, we hear the FIS is coming. I think it's fewer number than the X Games, but as I understand it, the reason they wanted to come here, or they were sold on coming here, was that I think that we've got a pretty good way of handling quarantining and isolating and creating the bubble and all the things necessary to keep people safe. And I don't know if anybody can give us an update on that, but as a big event coming to town, it raises eyebrows, and it might be worth just describing that to us if John or someone can.
Yeah, I can take a first stab at that. We have been in planning conversations with FIS and SKICO and our local public health department. I think that the highlights here are that we learned a lot from working with X Games and the amazing planning ability they had behind them with Disney and ESPN. And so we felt like there were a lot of things that we wanted to make sure that we could replicate with this FIS event. And so some of those requirements will be that we've learned from that worked so well with X Games, requiring testing every 3 days when folks are here, having a protocol for that isolation and quarantine, ensuring that all of the events are in accordance with our local and state level requirements, that there's a plan for scaling up or scaling down if the dial level changes. All of those things that were in place with X Games, and we went to level red restrictions, and the X Games were still able to operate in a very safe manner because they had done all of that planning and understanding that might be a possibility for their event. So we've taken all that we've learned and are continuing to build out that plan. I think some of the concerns we had before X Games came were around, not only what would happen at the facility, but what would happen when athletes or folks that were associated with the X Games were in town and not at the venue. And it turned out that there was a lot of communication. There were processes put into place to ensure that athletes and anyone associated with the X Games that were coming understood what the requirements were, what was required of participation there, both in acting when you are at the venue itself and then also outside of the venue. And so we're taking all of those learnings with what was created a very successful event with X Games and applying them to the event with FIS.
That is great. And I think all of us need to take some pride in the work that was done for the X Games, both the ESPN as well as our community. So it was a very successful event, very positive comments afterwards. And we look forward to having FIS in March. So anyone else for round robin? If not, I'm going to be looking towards the schedule for our next board meeting. Jordana, what's the date? 2 weeks from now?
2 weeks from now is the 25th.
Okay. And let's all put that on our calendars at 1 o'clock, 1 to 3:30 on the 25th. And if necessary, we'll call a special board meeting if we see that it will be necessary. But I think we're moving, well, I know we're moving in a very positive direction in our community. And we all need to take a great deal of pride in the work we're doing, the public health board, the public health staff, and the community, all the members of the community who are really trying to eradicate this virus. So let's all stay positive and well, I'm from Michigan, so the word would be go blue. But let's have a good ski season, and let's hope we get more snow so you can all get out there and enjoy it. All the best. Any other comments? And with that, I'll ask for a motion to adjourn the meeting.
So
Thank
moved.
you. Thank you. Thank you, Greg. And all in support, raise your right hand. Take care, all. Have a good few weeks.
Thank you all.
Bye.
Marky. Thank you, Georgiana, and your staff. Great job. See you, Tori.